Hello and welcome to today's webcast titled Creating Sustainable Public and Private Exchanges, Engaging Consumers Through Education and Member Tools. We have just a few announcements before we begin. The slides will advance automatically throughout the presentation. To enlarge the slides, click the Enlarge Slides link located above your presentation window. Should you need technical assistance, click on the Help link. If your screen freezes or the slides do not appear to be advancing as they should, please try exiting and restarting the session as it may be an issue with your connectivity. At any time, you can submit a question using the Ask a Question box located in the bottom left-hand corner of your screen. Please note participants dialed in on the phone will experience a slight delay between the audio and the slides. I will now turn the call over to Robin Gelberg, President, Fair Health. Please go ahead.
Hello, I want to welcome you all to today's webinar. We're heartened by the enormous expression of interest in today's program. The extraordinary number of participants demonstrates that you all have recognized a vital fact about this new healthcare landscape, which is that the ongoing success of public and private exchanges will pivot on the ability of key stakeholders, including federal and state officials, exchange operators, navigators, plans, brokers, employers, unions, consultants, vendors, TPAs, healthcare providers, call centers, and consumer advocates, among others, to effectively engage and support consumers with tools and resources as they become exposed to offerings on a public or private exchange. This afternoon, we'll discuss certain trends in the healthcare industry and how such trends are inextricably linked to the need for greater cost transparency and consumer engagement in the exchange marketplace. We'll explain why transparency is not enough. One must move from transparency to clarity to truly reap rewards in these new virtual shopping bazaars. We'll provide those of you familiar with Fair Health with a brief overview of our origins and mission and talk a little bit about our rich repository of claims data and the auditing and validation processes in place to ensure data integrity. We'll then discuss how our billions of claims provide in effect the electricity for our educational, user-friendly consumer website and cost lookup tools, mobile app, and broad suite of interactive dashboards for plan selection and management. Finally, we'll discuss how our data also informs and electrifies a separate grid dedicated to management tools and resources for the diverse exchange ecosystem. These tools and resources seek to ensure that this new paradigm involving public and private exchanges has a solid foundation. As most of you know, consumers are increasingly being asked to take a more active role in managing their healthcare expenses. For example, studies have shown that these challenging economic times have caused consumers to plan for and scrutinize more carefully their healthcare expenditures. High-deductible health plans continue to rise, which necessitates a heightened level of consumer engagement. Indeed, the number of employees covered by high-deductible health plans has more than doubled, from 6.1 million in 2006 to 13.5 million in 2012. Another recent industry study reveals that 1 in 3 employers now offer their employees a choice of a high-deductible health plan. Health savings accounts are also on the rise, requiring consumers to pay closer attention to their healthcare spending and planning. New tiered networks, again, require consumers to roll up their sleeves and understand the implications of choosing from among various provider network designs. Likewise, shifting reimbursement models, such as those involving out-of-network reimbursement, are causing consumers to ask more questions and plan more diligently for their healthcare services and procedures. Finally, the recent emergence of private exchanges and impending launch of public exchanges again puts the consumer to a large extent in the driver's seat of their care. Unfortunately, at the same time that the ground is moving under the feet of consumers, they have been given few tools to help navigate the complex world of health insurance. For too many consumers, decisions are still being made in the dark about what care to access and at what cost. Often they learn about the cost of certain procedures after they are performed, particularly in the case of consumers going out of network for care or managing their high-deductible health plans. The surprise they receive when learning of their responsibility for payment leads to strained relations with providers, plan representatives, and employers, especially against the backdrop of this economic climate, when now, more than ever, financial planning and sound decision-making are critical. We hear from consumers directly about their frustrations and feelings of discouragement as they try to make sense of their health policies, EOBs, and healthcare bills. In many respects, based on the neutral role we play in the marketplace and our exposure to all stakeholders in the market, including consumers, Fair Health becomes like the canary in the coal mine, learning about issues of concern before they even emerge in full public view. Our more formal consumer surveys replicate the stories we hear directly and demonstrate consumers' strong appetite for clear online tools that offer both cost and educational information. Many consumers confronting exchanges will be new to health insurance altogether, and whether a particular consumer is new to insurance, most consumers will be new to the exchange model, which has just emerged. Industry experts readily acknowledge that strong consumer engagement will be required in order to create a sustainable model. Likewise, data and management tools need to be easily accessible to help inform smart decision-making. In many respects, building the various exchanges are like building a new house. Just like any new house, it needs a strong foundation. Effective consumer engagement requires a multi-pronged approach. First, consumers need clear educational resources for context. They need the vocabulary of insurance and the principles that would help govern sound decision-making. Next, they need cost information that is robust, geographically textured, and above all, reliable. So-called cost transparency that is not grounded on a rich data platform can actually add to the confusion rather than shed light on healthcare decisions. Next, they need easily navigable plan selection tools that allow consumers to make enrollment decisions tailored for them and their family. Finally, once they select a plan, consumers need ongoing decision support tools to support effective management of their plan benefits and healthcare expenditures. Every day, newspapers, radio and television programs, online journals, blog posts, and other media outlets, as well as companies, invoke the notion and importance of quote-unquote cost transparency in healthcare. However, there's a meaningful difference between transparency and clarity. For example, if you think of data as equivalent to dishware and silverware, you can have a sink filled chaotically with dirty dishes and silverware that is transparent to the eye, that is, you can easily see the pile in the sink. However, that pile of dishes provides little comfort or value. Alternatively, you can have a beautifully set table that brings order and clarity to those same elements. Bombarding the consumer with a transparent data source that does not make sense or that constitutes, in effect, a chaotic pile of information does little to inform the consumer or advance constructive decision-making. Rather, consumers need the requisite clarity to optimize their healthcare experiences. Thus, when Fair Health talks about transparency, we mean clarity. I thought before we walk through a series of slides that illustrate a variety of tools for consumer engagement, it might be helpful to provide some background about Fair Health. Fair Health, for those of you who don't know, was established in 2009 as a result of an investigation brought by the Office of the New York Attorney General into certain healthcare reimbursement practices in New York. The parties to the investigation settled and agreed to establish a new, independent, not-for-profit organization that could be trusted in the marketplace and whose mission would be to bring fairness and transparency to health insurance information. To fulfill that mission, we produce a suite of robust data products and custom analytics, operate a consumer website that was recently honored by the White House and industry leaders, and offer a research platform to support policymaking and health systems research. While the investigation that gave rise to Fair Health started in New York, we are a national organization and currently support data licensees who either insure or process claims for over 150 million covered lives. Our data also supports numerous workers' comp programs, auto liability programs, state health insurance programs, provider dispute resolution programs, fraud detection platforms, consumer advocacy and assistance programs, provider network design, and the development of in-network and out-of-network fee schedules and other reimbursement models. So what makes Fair Health unique? In addition to our unique history, we have a number of unique features. The settlement agreement prescribed that we employ the talents and expertise of economists, statisticians, and academic researchers in developing the underlying methodologies and algorithms for our database. Toward that end, we collaborate with a broad national network of academic institutions and experts who advise on data contribution and validation processes, outlier methodologies, unit threshold requirements, small cell algorithms, and the like. We house, collate, and analyze de-identified claims for over 129 million covered lives. The data are organized into 491 distinct geographic areas or geozips, which tend to track with the first 3 digits of a zip code. We receive contributions on a rolling basis. Currently, we have over 15 billion medical and dental procedures in the repository from 2002 to the present. That number continues to climb as we receive new data contributions. The billions of claims in our repository are then aggregated into distinct data modules. We have a number of different data flavors, if you will. We offer a medical surgical module, a loud medical module, dental module, anesthesia module, and HCPCS module from our private claims data repository. We also offer an inpatient and outpatient module drawn from CMS data, which we analyze and configure into distinct products. Finally, we offer an unlimited array of custom analytics based on the specific needs and requirements of the data licensee. These data products and analytics also serve to fuel the wide variety of consumer tools and resources we offer. When the settlement was reached in 2009 amongst the parties, the Office of the New York Attorney General referred to the consumer website as its crown jewel. We're delighted to have recently added another jewel to that crown. As many of you know, on April 1st, we launched a new mobile app that provides cost and educational information to consumers on the go. The Fair Health consumer website features a homegrown curriculum called Reimbursement 101, which was developed in collaboration with health literacy experts and subject matter experts, and offers over 20 chapters on issues relating to health insurance, such as segments explaining HMOs and PPOs, emergency care and urgent care, anesthesia reimbursement, different varieties of dental health plans, tiered provider networks, in-network care versus out-of-network care, mental health parity issues, and the like. We also offer glossaries of insurance terms and medical and dental terms, as well as a rich library of healthcare resources. We use clear, concise language, original graphics, and videos to make the content accessible and non-threatening. We also offer content in both Spanish and English. To assist the consumer on the road once they embark on a cost lookup, we developed an easy-to-use taxonomy of procedures with the assistance of clinicians and a Robert Wood Johnson scholar. We also developed a tool we call FH Estimate Assist, which allows consumers to populate their virtual shopping cart with related procedures in order to give them a more three-dimensional cost estimate. You'll see an example of this feature in a few moments. We likewise developed another consumer tool called FH Medicare Compare, which allows consumers to understand their out-of-pocket costs if their plans use a Medicare multiple to calculate their out-of-network reimbursement. You'll see this feature in a moment as well. The lookup tool can be customized to meet the consumer's needs and plan design and offers clear context to explain the cost results they obtain. I think it would be helpful to demonstrate for you a quick medical search. Keep in mind that the consumer website also offers a companion dental cost lookup tool. To get started, the consumer simply enters the zip code or city and state where they are obtaining their medical care. Today we will use Hartford, Connecticut as an example. They then indicate whether they are insured or uninsured. We default to insured, but if they are uninsured, they can indicate that fact and be brought to a different results page that does not calculate costs based on insurance plan design. Next, they simply enter their CPT code, or if that is not known to them, they can navigate through our easy-to-use taxonomy of medical procedures. If they have questions about the meaning of certain medical procedures, they can consult our medical glossary. Let's assume the consumer is planning to get a colonoscopy in Hartford, Connecticut. After putting in their location and their insured status, they would click colonoscopy and other endoscopy, which would then allow them to narrow their search to colonoscopy. The consumer would then be presented with medical procedures related to colonoscopy in the order of frequency found in our data repository, the top procedure being the most frequently occurring in that geographic area. Let's assume the consumer chooses the most common procedure. This is the results page that provides the consumer with the estimated charge for that procedure in that geozip, as well as the estimated level of reimbursement based on common plan design. A few things to note. First, the yellow plus sign circled to the left indicates the FH Estimate Assist functionality and notes that other related procedures might be of interest to the consumer. The Adjust Percentage and Adjust Percentile sliders on the bottom of the page allow the consumer to customize results to their plan design. We default to the 80th percentile of charges in that area and then take 70% of that amount to calculate the consumer's out-of-pocket cost. Both the percentile and percentage can be adjusted as necessary for the consumer. This was one of the features singled out by the White House at its Summit on Smart Disclosure that rendered our website noteworthy as a smart, actionable tool for consumers. This slide shows how the FH Estimate Assist works. This tool is prompting the consumer to consider the anesthesia and pathology charges associated with the planned colonoscopy. If the consumer wants to add these procedures to their estimate, they simply click on the relevant box. This slide shows that with the added procedures, the consumer can be expected to pay out of pocket approximately $660 for those 3 related procedures. Please note the circled language to the right. This slide indicates that these results are based on UCR-related data. That is, data drawn from the Fair Health Repository, data that reflects actual market conditions on the ground. If their plan uses a Medicare-based multiple instead of market data to calculate out-of-network reimbursement, the consumer would merely click on the tab Medicare-based instead of UCR-based. This slide shows the same procedures in the same geographic region with the same charges being calculated using a Medicare-based formula. To easily appreciate and visualize the material difference between UCR-based and Medicare-based plan design, you would click on our Medicare Compare tab, Compare Both. This graphically demonstrates how a consumer can be unwittingly exposed to a large balance bill if they go out of network without understanding their responsibility under their plan design. In this case, if they had a Medicare-based plan, as opposed to a UCR-based plan, they would have a potential out-of-pocket bill that is $1,000 higher. Many brokers, TPAs, consultants, and plan representatives do not fully appreciate or understand these differences and sometimes do not adequately communicate these differences to employers or consumers before such a plan design is chosen. Having access to this type of tool can help inform those discussions. Before moving to the mobile app, I should note that the consumer website can be branded, customized, and privately labeled in whole or in part for organizations' internal use or on a member-protected portal. Now I would like to switch gears for a moment and quickly run through some sample screenshots of our new mobile app, which became available, as previously mentioned, on April 1st. It is now available on the iPhone. The Android version will be released in a few weeks. The mobile app can also be customized and separately branded for internal or member use. This is the landing page of the mobile app. It offers a clean design that distills the consumer website to its essence. You would browse for cost information in a similar fashion to the consumer website. You would choose a category using the same taxonomy that is on the consumer website. You would then select the specific procedures of interest using a listing that is in order of frequency from our repository. It offers versatility and customization and allows you to add related procedures and adjust your settings indicating the percentile and percentage formula relevant to your plan. It likewise offers the same educational platform of the consumer website, allowing consumers to scroll through the complete selection of Reimbursement 101 chapters. The mobile app also includes the various glossaries offered on the consumer website. Now we thought we would move to the next ingredient for successful consumer engagement, decision support for plan selection. How do consumers begin to make sense of the options available on public or private exchanges? Experts agree that they will need clear signs on the road to help them navigate this new insurance paradigm. As a natural extension of our mission to bring fairness and clarity to health insurance information, we have developed a series of web-based tools that utilize an API functionality, that is, application programming interface technology, that allows customers to draw data from our repository to inform easy-to-use plan selection tools. What we will be demonstrating today are a series of prototypes that can be developed to support exchanges, plans, brokers, employers, consultants, call centers, and those serving as navigators. These tools allow consumers to sort by tier, by plan, by common condition, and by geography. With respect to the public exchanges, the timelines for implementation of consumer decision support tools are very tight. Accordingly, we have the capability of making these tools available on a turnkey basis using an agile development approach so that exchange operators and plans can turn to other important implementation requirements and check these off of their list. Alternatively, we can work with your vendors and technical teams to embed our data in tools you already have or may already be planning in order to create a seamless infusion of up-to-date data for your solutions. Whether we provide a turnkey solution or simply license our data for use on your own developed sites, we customize the tools and data to conform to the specific benefit design and reimbursement model being featured. For example, we know a number of you registered for this webinar are currently data customers of Fair Health. Some of you license our benchmark series of products, which are based on actual data, while others of you use our RV benchmark series, which uses a derived methodology. Accordingly, we would tailor the API functionality to draw from the data source that is particular to your business operations. Let's now turn to the specific views available for your operations. This is an example of the sorting capability I alluded to earlier. If I lived in Chicago and was trying to understand the plans that were available in my area on either a public or private exchange, I could browse through a series of screens that provided key data points about my options. First, I would want to know how the tiers were categorized. To do that, I would click on the tab, What do the plan tiers mean? That pop-up explanation would walk the consumer through at a high level the key differences between the tiers. Next, the consumer might want to see all available health plans in their area, in this case, plans in the Chicago area. To do so, the consumer would click on the tab at the bottom right side of the page. This slide demonstrates how plan data can be sorted to help the consumer gain some insights into plan offerings. Let's say as a consumer, I prefer to narrow my search and look specifically at only bronze options. I would go to the welcome screen and click on bronze. I would then be presented with the 4 bronze plans offered on my exchange, whether it be a public or private exchange. Let's say that I'm familiar with the first 3 carriers listed and want to investigate them further. I would check the relevant boxes to the right under Compare Plan Benefits and click Compare Plans. I should emphasize before we go to the next slide that these slides have been developed as sample prototypes and do not include the aesthetic bells and whistles and branding details that would be added depending on who was utilizing them and for what purpose. Likewise, the column headings are flexible and can be tailored to the user. You may want some but not others, or may want to add some additional data points as a means of comparison. And it should be noted that these API tools are fully scalable and can accommodate a larger or smaller number of plans than those demonstrated here. Okay, let's look at the next slide that offers a drill down into the 3 bronze plans selected. On this slide, you see the 3 bronze plans selected by the consumer. This slide provides a description of plan benefits, the relevant CPT code, the market rate for the procedures listed, which is drawn from our claims repository, and finally, the opportunity to compare cost features among the different plans. The market rate feature is an important window for consumers. By gaining an insight into market rates, they can appreciate the value proposition of obtaining insurance and avoiding having to pay market rates they may encounter as an uninsured individual accessing care. Now let's assume I was a consumer who needed a knee procedure in the coming year and wanted to see how that procedure would be treated under different plans. I would click on Compare Cost. Now let's look at that comparison. This slide shows me the in-network and out-of-network costs associated with this particular procedure under the 3 carriers. The in-network features would be populated based on plan-specific details. The out-of-network profile would be informed by our geographic-specific data under the category Estimated Provider Charge. The estimated reimbursement would be calculated based on UCR market formulas determined by the particular plan. If the plan determines to use a Medicare-based fee schedule instead, we would use our Medicare Compare tools as demonstrated previously. If the plan uses yet another form of reimbursement, the tool could accommodate that formulation and juxtapose that design with our market data. This slide allows the consumer to explore plans based on common conditions, chronic diseases, or certain health profiles. For example, assume I'm a consumer with type 2 diabetes who has had no interaction with private insurance to date. I want to appreciate what care on the exchange means for me in terms of cost and out-of-pocket responsibility. Similarly, if I were an adult male seeking information about what a wellness profile would look like and what my estimated cost would be over the course of a year, I would click on Wellness Profile, Adult Male, and so forth. These conditions and profiles were selected for illustration purposes only and obviously represent only a tiny fraction of the types of conditions and profiles that could be posted. Let's now click on type 2 diabetes to get a sense of what my costs may be in the course of a year of coverage. After clicking the type 2 diabetes tab, I would be brought to this slide, which lists a number of procedures based on best practices associated with type 2 diabetes. It allows me to see what the market rate is. The market rates are drawn from our repository, and to appreciate what my costs would otherwise be without insurance. It then allows me to remove or tabulate a series of procedures to view both the in-network and out-of-network amounts I would have to pay. Again, the estimated charge in the out-of-network box is drawn from our repository. The other elements in these 2 result boxes would be based on the particulars of the plans being evaluated. This view allows a consumer to sort by carrier rather than by plan tier. So assume I have previously had insurance with a certain carrier through my employer and am familiar with that plan's services, or I have seen advertisements or heard from friends positive things about a particular plan. I may want to look at that carrier's offerings rather than search by tier level among all carriers. I would simply click Carrier A to go to a dedicated page associated with that insurance company. Once clicking Carrier A, I would then be taken to this page. It would allow me to examine key features associated with all of Carrier A's plans. Now let's assume that I would like to drill down further on some of the tiers. I would click on the box under Compare Plan Benefits. In this case, I'm selecting the first 3 because I've made a decision that Platinum may be out of reach for me. This would bring me to a results page that allows me to compare the specific benefits and in-network and out-of-network costs associated with the bronze, silver, and gold plans of Carrier A. I could also compare by condition as well, so that if I had type 2 diabetes or any number of conditions, I could compare the costs associated with each of the tiers selected. Once a consumer has explored these plan selection tools and is ready to make a decision, the nature of consumer decision support changes. It shifts from plan selection to plan management. The consumer will now need ongoing tools to assist them as they make their healthcare decisions and plan for their healthcare expenditures. Plan management tools should ideally have customizable views to allow for the particulars of specific plan features, offer easy-to-access information, allow for an interactive workbook functionality, and offer reliable data that is relevant to the geographic area. Okay, let's say I'm a person named Jack Robinson living in the Chicago area. I like the Silver plan under Carrier A. So now I am in the plan and want ongoing support. Ideally, I would have this member-protected portal offered to me by my plan or the equivalent that allows me to search specific procedures I'm contemplating and appreciate what the out-of-network and in-network costs associated with that procedure are. It should be noted that the deductible information in the window to the left would be information provided by the plan operator. Again, these views are all customizable and can contain those data fields of particular interest to the plan or required by the exchange. If I now want to park this procedure in my personal profile so that I can track my healthcare experience, I would click on Add to Cost Workbook. To then view my workbook, I would click Cost Workbook. After selecting the Cost Workbook feature, I would be brought to this view, which would allow me to see an inventory of planned or obtained services so that I can track my potential expenditures and my healthcare history. Consumers are not the only stakeholders who need robust data and tools to support their interaction with a public or private exchange. In order to fortify the variety of roles associated with the management and operation of an exchange, whether you're a public exchange, privately operated exchange, consultant, health plan, dental plan, employer, union, TPA, vendor, broker, navigator, or other stakeholder in the exchange ecosystem, you will need reliable data and sorting tools to make a variety of key strategic and effective decisions all along the way. Just like consumers, you need clarity as well as transparency. Having cost and utilization information easily accessible and clearly presented will allow you to effectively tailor your B2C outreach campaign, design smart and fair in-network and out-of-network fee schedules, shape benefit design, frame employer communications and employee educational programs, support call centers, engage in strategic planning regarding a variety of exchange operations, including providing network design and wellness programs, inform dispute resolution programs, and support consumer advocacy programs such as assisting with post-claims payment balance billing disputes. I thought it would be helpful to show you a sampling of a few of the dashboards we have available for operational and management support. We have developed dashboards that allow you to compare plan features, understand specific market conditions by procedure or condition, do trending analyses over time, and also view commercial market data against other indices such as Medicare and Medicaid. So if you are seeking to understand, for example, emergency care in particular markets and how that market has changed over time, you could click Trend Analysis. You would then be taken to a results page that juxtaposes cost and frequency data relevant to emergency department visits. If you saw a particular geographic region with unusually high utilization, you might consider expanding your primary care network, incentivizing care management, or introducing some other features to your plan design in order to reduce ER utilization. Let's assume you were trying to plan for negotiations with OB/GYN providers to support your members or plan for the costs associated with maternity and newborn care across the state. You could click on the tab GeoCompare. You would then be exposed to all of the GeoZips in a given state. In this instance, you are looking at a slice of the 24 GeoZips in New York. As you can see, there can be material differences between markets, which might help inform certain in-network and out-of-network pricing decisions, as well as inform premium rate design. For a variety of planning and strategic reasons, you might want to vector commercial market data with Medicare and Medicaid rates for the same procedure in the same geographic area. This dashboard would allow you to do that, again, incorporating our data into the analysis. If you wanted to isolate a specific code for review, you could use this dashboard for analysis. Again, you might want to customize these management tools by adding a fourth column for the allowed amount or negotiated rate, or delete Medicare or Medicaid if those data sources are not relevant to your needs. I want to leave sufficient time for your questions, so I will just quickly expose you to 3 slides that sample our dental tools. This slide is the dental companion to the tool I just showed you involving medical care. As with the medical tool, you can study and compare plan details, costs, obtain trending analyses, track utilization, and do geographic cost comparisons, as well as comparisons between plans. This slide shows how you can drill down to a single procedure for either consumer use or operational and management needs. We've developed a list of common conditions drawn from our FH Dental Estimate Assist that allows consumers to bundle certain related procedures together for a cost profile. We have a wide variety of other dental tools, including tools that juxtapose commercial and Medicaid dental rates, but want to be sensitive to time. If you want to review additional dental tools or other tools we do not have time to demonstrate today, or review some of the materials I demonstrated today in more depth, please reach out to me offline. I think all of us would agree that we are living in interesting times. The healthcare industry is changing before our very eyes. We feel energized and excited at Fair Health about the change underway, but recognize that missteps could easily slow down progress. Success on public and private exchanges will, in large part, depend on effective consumer engagement and smart use of data. 2 areas that are already core to our mission, expertise and day-to-day focus. We would be delighted to share that expertise and data with you to help you create a winning strategy that meets your specific needs. I want to thank you again for joining us today, and we'll now be happy to answer your questions. If we do not get to your question this afternoon due to time constraints, we'll follow up with you separately. Okay, so here are some questions that have come in. One is, where does your cost data come from? Well, claims, because it's such a large repository, we don't accept claims from providers, but rather accept claims from insurers, so there's not duplication in the database. So right now, our claims data, as mentioned, is coming from over 60 contributors across the country that collectively represent over 129 million covered lives. There's another question here. Do you have the ability to work with our developers to integrate your data into our exchange applications? Yes, as I noted, we have developed a series of APIs that facilitate integration of our transparency tools into other organizational websites, and our tech team would be happy to work closely with your teams throughout that process. How are consumers using this data today? We offer cost estimation tools and resources as noted at our consumer website and through our mobile app. And what we're learning from our consumers who reach out to us via email and through our surveys is that they're using it for a variety of purposes. They use it to help make decisions in the first instance, whether they plan to go out of network at all. If they then decide to go out of network, they use it as a benchmark for assessing costs when calling different providers. They sometimes discuss these fees with their providers to negotiate, and they sometimes use the data to populate their appeals. It says, is it possible to customize tools to incorporate our organization's specific look and feel? Yes, as I noted, we can easily brand it and help you brand it to really incorporate your own particular flavor and messaging. And as I said, we can make our tech teams available to yours to help really make it as though it's one of your offerings directly. Our exchange is considering only providing in-network benefits. Is there still a place for these types of tools? Yes, of course, these tools can provide consumers with assistance in the first instance of understanding the value of participating on the exchange. As noted, and as all industry experts recognize, a lot of folks are going to be new to insurance and may be weighing whether they should enter the exchange at all and what the value proposition is for them. They may feel it's a better deal to pay the penalty and really may not fully appreciate what their cost exposure is. By looking at the market data and understanding what their healthcare needs are, they can make that assessment. Also, just the educational materials are helpful to consumers, whether you have in-network alone or both, giving them the vocabulary and the fundamentals and the platform that we offer, which we sort of call our driver's ed, really before giving consumers the keys to the car of cost information, can be very helpful. Also, for those exchanges who are only looking at in-network, the data itself can help you internally to develop fair and transparent in-network fee schedules that are appropriately tailored to your market. Does Fair Health have cost data for every state? Yes, we have medical and dental cost data for all 50 states, as well as for Washington, D.C., Puerto Rico, and the U.S. Virgin Islands. How do you ensure that your data are reliable? As I mentioned, it's somewhat unique in that built into the settlement agreement itself, it contemplates that we use statisticians, academic researchers, and economists and the like to really opine on the methodologies and algorithms we use. Those then become the platform by which we aggregate and validate our data. In addition to that, we have a number of processes and edit checks that help evaluate the data, for example, making sure that the zip codes are valid and including different types of outlier methodologies to make sure that we are really wrapping our arms around valid data. This is an ongoing process, and we have a separate staging site that is engaged in ongoing quality assurance. How does Fair Health go about developing its educational curriculum? We work with subject matter experts and health literacy experts, as well as the original artist, Robert Newbecker, whose drawings you've seen, and you may have seen actually in the New York Times. He's a nationally recognized artist. From the beginning, we realized that insurance is very intimidating to many, regardless of your level of education, and we really felt it was important to make this information accessible and sort of soften the edges to the types of information we provide. So we are very attentive to the type of content we use and that we present it in a consumer-friendly manner. We also have a number of advisory boards. We have a consumer advisory board that has national consumer and patient disease advocates that we consult to make sure that our content is accessible. Can you advise who to contact to put a link on our website? You can use me as a point person, and then I can direct you to the appropriate individuals within our organization who can answer all your questions and attend to those needs and working through any type of link. What is the cost to access your data and tools? So in terms of the licensing fees, that really depends and runs the gamut of what your needs are, whether you are looking to license, for example, just certain portions of our educational content, whether you are looking for a broader suite of national products, whether you are looking for some customization with respect to a web offering. So that is something that we're happy to discuss offline and is very tailored to your particular needs. As a not-for-profit, we obviously are very attentive to cost, and so we are happy to discuss those issues with you directly. And again, you can use me as an initial point person, and I will direct you to the appropriate person in our organization. Won't the health exchanges have the tool to compare plans available and the various products tiers offered. Some may have, and for those exchanges that are planning to centralize it on an exchange website, we can work with those centralized sites, and they may not have the market data available to help enlighten what those choices are. So in that instance, that's a perfect example where we would not need to help you develop the full site, but can work with vendors already working with the exchanges. Some states have made it clear they may not offer a centralized website, but require all the qualified health plans who are going to be operating on the exchange to have their own URLs that link to the exchange site. And in those instances, we are happy to help those plans meet those exchange requirements. How can brokers use the information you provide? Oh, in a number of ways. Well, first of all, brokers can clearly benefit from understanding what the implications are of different reimbursement models. So in the example I showed previously regarding the Medicare Compare situation, we have instances now and where we've seen brokers offering to employers the option of health plans that are based on, for example, 80% of UCR, which may implicate our data, or 140% of the Medicare multiple. Many employers are confused when they see that and think 140% sounds extraordinarily generous, and they want to do right by their employees while also managing costs. So they may select that option without understanding that having selected that option, they just exposed their employee to $1,000 more in terms of a single procedure in that colonoscopy instance. Brokers, if they had an easy dashboard to look at incorporating our data with a Medicare multiple, for example, they could have their own, in a sense, Medicare Compare application that allows them to help inform their clients. Also, if they had the type of summary of plan options that we demonstrated, that would allow them to have really informed conversations with employers as well as with just giving them their own sense of understanding of the market that they're serving in. They may also be interested in creating their own educational hub on their own brokerage site that's a value add to the clients they serve. So if they wanted to centralize, for example, the Reimbursement 101, the glossaries, all the other information that allowed easy access to hook into our data, that's a conversation we would be happy to have. This morning, my doctor asked why doctors don't have more information about the new environment. They're seeking information and want to know where to find it. Well, toward that end, we actually have a separate portal that we offer to providers to give them really an appreciation for cost data relevant to their clinical area. And we are going live soon, really trying to put the educational information into the hands of providers so they will be able to download for free our educational materials to make available in their doctor suites or other practice settings, as well as separately, if they license some of our products, they can brand at no cost those informational materials to use on our separate website, feeestimator.org. Let me see if there are any others. How do your benchmarks account for the variability of provider charges within a geographic area? Well, the data for each procedure code in each GeoZip are arrayed from lowest to highest and organized by percentile. So organizations, plans, et cetera, they can choose which percentile to use, whether it's the 80th, the 50th, the 75th, to meet their particular business needs. What is the time frame covered by the data modules? That's a good question. Each data module contains 12 months of data, which is refreshed with each new release of the module. Some modules are released twice yearly and others are quarterly. I think that covers pretty much most of the questions that have come in. So I want to thank you all again for your time and attention this afternoon, and Again, feel free to reach out offline for additional information, more details. Happy to put you in touch with the right person within our organization and make sure your needs are met. And I wish all of you the best of luck as we move into this new era. Thank you.
Thank you. Ladies and gentlemen, currently you should see a new window appear on your screen that asks for additional feedback. If you have any additional feedback you could provide that would help us improve this program for future authors, please take the time to submit your comments here. We thank you very much for your time and attention. This webcast is now concluded.